Hello everyone. So today we are going to discuss about what are phobias, what are the types of phobias and how the phobias affect a person. So phobias are intense, irrational fears. This means someone might feel terrified of something that's that isn't truly dangerous. For example, someone might faint just by seeing a spider, even if it's not harmful. They cause anxiety and avoidance. A person with a phobia will often go out of their way to avoid the object or situation they fear. For example, not attending a birthday party if there's a dog present in case of cynophobia, like fears of dog. Phobias are a type of anxiety disorder. They fall under the same category as generalized anxiety disorder or panic disorders. Now let's move towards the types of phobias. Specific phobias, like fears of particular things or situations like height, snakes, spiders, injections. Now, social phobias, social anxiety disorder, fear of being judged or embarrassed in a social situation. For example, being afraid to speak in class or eat in front of others. Next, agoraphobia, fear of situations where escape seems difficult, like fears of crowded malls, public transports. These are the few types of phobias. Now move towards the common examples of phobias. First one is arachnophobia, like fear of spiders, a very common specific phobia. Acrophobia, like fears of height. People may avoid tall buildings, balconies, or even stairs. Claustrophobia, fear of confined spaces like elevators, tunnels, or small rooms can trigger panic. Aerophobia, fear of flying. This can prevent people from traveling by plane. Trypanophobia, like fear of needles, can lead to avoiding medical treatment or vaccinations. Now let's move towards the symptoms of phobias. There are actually three types of symptoms for physical, emotional, behavioral. Physical symptoms include sweating, trembling, fast heartbeat, dizziness. The body goes into fight or flight mode. Emotional symptoms are extreme panic or fear when facing the phobic object or even thinking about it. Behavioral symptoms are the person start avoiding the situations completely. For example, skipping school because of a fear of crowded hallways or because of the crowded classrooms. These are the few symptoms of phobias. Now move towards the causes of phobias. What causes phobia? So, traumatic experiences. For example, a child bitten by a dog may develop a lifelong fear of dogs. Learned behavior. Children may copy parents. If a parent screams when they see a spider, the child may develop the same fear. Genetics and brain chemistry. Some people are more sensitive to fear due to how their brains are wired. So, these are the few causes of phobias. Now, move towards the managing and treating phobias. These are the few therapies and few techniques that you can use to treat your phobias. First one is cognitive behavioral therapy. This is the most famous therapy, a form of talk therapy that help people change the way someone thinks about his fear. This therapy helped the people to change the negative thought pattern into a positive thought pattern, and this is no doubt a very helpful therapy. Second one is exposure therapy, in which a person slowly facing the fear in small and easy steps, like safe steps. For example, someone afraid of a dog may start by looking at a picture, then watching a dog from a distance, and then from the time being it lower its distance. Gradual exposure to the source of fear is used to reduce the anxiety. Now, medication. Sometimes doctor prescribe medications for severe cases to reduce anxiety. They give the patient antidepressant so the person feel relaxed. Uh, he doesn't feel like anxious, so the heartbeat become normal, and headache become normal. Now the next one is support group and relaxation, like breathing exercises, meditations, peer support can also help. Also, the deep breathing is the most famous and the most relaxing therapy in treating phobias. Now, phobias are real and serious but treatable. Without support, people can overcome or manage their fears. Early intervention is important, but sooner the help is offered, the better the outcomes. Let's be supportive and non-judgmental. We shouldn't mock or ignore people with phobias. Instead, we should help them and make them feel safe. So, today we have explored a very important topic, phobias. We have learned what they are, what causes them, how they affect people and how they can be managed. I hope this helps you understand that phobias are not just fears. They are a real emotional challenges that many people like living in their everyday life. So be kind because everyone is fighting a battle you may not see. If you or someone you know is dealing with a fear that feels overwhelming, don't ignore it. Talk to someone like a parent, teacher, or counselor because help is always needed. If you have any question regarding phobias, how to treat them, how to consult a doctor, how to consult a psychologist, you can also leave a comment so that I can help you easily. Thank you for your attention.